Bismillah ar-Rahman ar-Rahim. Our topic is about corneal pathology. This is a normal cornea. The cornea is composed of epithelium, basement membrane or Bowman membrane, followed by the corneal stroma, which is the main bulk of the cornea, and then the descent membrane and the corneal endothelium. This is to show us the corneal endothelium, the corneal epithelium as a start, followed by the stroma. And in the other part, this is the endothelial cells. What is the differentiation between corneal dystrophy and corneal degeneration? As for degeneration, it occurs in middle age or older. Dystrophy occurs in young age. Degeneration is usually unilateral or asymmetric, but dystrophy is bilateral and symmetrical. There is uncommon family history in degeneration, but it's common in dystrophy. Vascularization is common in degeneration, but not common in dystrophy, and it occurs in the peripheral part of the cornea in degeneration, but it's central in dystrophy. To start with corneal dystrophies. These are some examples of corneal dystrophies. Of course, each part of the cornea has its specific types of dystrophies. As for the epithelium, there is heredofamilial primary in the cornea as Meesmann, dot, finger, and geographic map patterns, which is called microcystic dystrophy. As for heredofamilial secondary to systemic disease. Then subepithelial and Bowman membrane as in subepithelial mucinous corneal dystrophy or Reese-Buckler dystrophy. For stromal dystrophy, there are many types of, which is more common to us is the heredofamilial primary in the cornea as in granular, macular, lattice. All these are dystrophies. Avellino dystrophy, corneal hereditary stromal dystrophy, and other types. As for heredofamilial dystrophies secondary to systemic disease, like in mucopolysaccharidosis, mucolipidosis, sphingolipidosis, ochronosis, cystinosis, hypergammaglobulinemia, and others. But as for non-hereditary familial corneal dystrophy, there is keratoconus, keratoglobus, and pellucid marginal degeneration. As for endothelial corneal dystrophies, the most important one is Fuchs dystrophy, which is called cornea guttata, posterior polymorphous dystrophy, congenital hereditary endothelial dystrophy, and non-guttata corneal endothelial degeneration. We start one by one in these corneal dystrophies. Anterior membrane dystrophies, as in Reese-Buckler dystrophy. It is an autosomal dominant inheritance, recurrence painful corneal epithelial erosion that often begin in the first 1 or 2 years of life. There may be also ring or map-like opacities appear at the level of the Bowman membrane, eosinophilic and fibrotic material beneath the corneal epithelium anterior stroma with destruction of the Bowman membrane. As you can see in this slide, there is dense deposits in the stroma staged by Congo red, periodic acid chef, and Mason trichrome stain. This is another example also. as you can see, anterior stromal. As for macular dystrophy, it is an autosomal recessive disorders. It has two types. One type 1 present in childhood and is more common, lacks keratin sulfate in the cornea. There is no keratin sulfate in the cornea. As for type 2, which occur in the second decade, and there is keratin sulfate in the cornea. This is a picture of the cornea diseased. As you can see, there's multiple opacities in young age. Histopathologically, it's acid mucopolysaccharides, which is glycosaminoglycans deposits stained with colloidal iron and calcium blue stains. The upper one is the colloidal iron, and the second one is the lower one is the second type is granular corneal dystrophy. It is the ocular manifestation. It shows rod-shaped bodies which replace the Bowman membrane and lies between the epithelial cells. It is autosomal dominant with no systemic association are known. As you can see here, pathology highline granules deposits in the extracellular anterior stroma, red staining by Mason trichrome stain as in this picture. As you can see, Mason trichrome stains stain all the lamellae of the stroma blue and the deposited material red. As for lattice dystrophy, it is uncommon disorders, recurrent painful erosion in the young adult, decreased vision later in life. There are two types of the disease: autosomal dominant inheritance, find which is type 1, branching refractile lines within the anterior or the midstoma, sparing the corneal periphery. It is the most common type, as you can see here. Can you see it? Type 2 systemic amyloidosis. Autosomal dominant inheritance, lattice lines are thicker but less numerous than in type 1. The lines begin peripherally and progress centrally. Visual acuity is usually good, with minimal recurrent erosions. As for type 3, there is autosomal recessive inheritance. Lattice lines are coarser than in type 1 and go from limbus to limbus. There is no recurrent erosion. As I told you, it is amyloid deposits which stain pinkish red with Congo red stain and metachromatic with crystal violet stain. As you can see here, this is the two types of stains. This is to summarize the major stromal dystrophies and the histological stain. For macular stroma, for macular dystrophy, the deposited material is mucopolysaccharides stained by calcium blue. As for granular dystrophy, it is the deposited material is hyaline. It is present in Mason trichrome stain. Lattice dystrophy, it is amyloid material deposited stained by Congo red stain. For the posterior corneal dystrophy, of course, there are many types, but the one which is important to us is endothelial dystrophy and Fuchs dystrophy. And Fuchs dystrophy represent a group of disease involving abnormalities in the descending membrane that affect the endothelial cells. Before stromal edema occurs, the condition is termed endothelial dystrophy. After stromal edema develops, it is called Fuchs dystrophy. So, without without stromal edema, it is called endothelial dystrophy. After occurrence uh, of stromal edema, it's called Fuchs dystrophy. Fuchs dystrophy occurs in the fifth or sixth decade of life, especially more commonly in women. Inheritance is autosomal dominant, but can be recessive. Histologically, what we can see, there is tiny central excrescences and of the second desmic membrane known as cornea dr, pigment in the endothelium. As you can see here, thickening of the membrane, and there is engulfing of the endothelial cells with pigment in it, in the lower part. What is this? These are this fluffy part of the stroma. It is edematous, but the other one is a normal stroma. To the left is normal stroma. To the right it's edematous stroma, and this is also another shape for uh, stromal edema with cornea gatata in the lower part with engulfing of the endothelial cells, and there is presence of gut. This is edema of the cornea resulting from cornea gatata. As you can see, there is edema in the epithelial edema with a part of shaded bulli in the upper part, and there is severe stromal edema. We shift to keratoconus, which is a non-inflammatory progressive thinning of the cornea, usually bilateral and asymmetrical. Sporadic, but 10% family history is present. This is a case of keratoconus. Histologically, is there a thinning of apical stroma, sectioned ectopic cornea that has a wavy configuration, compensatory hyperplasia of the epithelium with dehiscence in the Bowman membrane. As you can see, this one. And this is the dehiscence of the Bowman membrane, this yellow arrow, and this is the configuration, the wavy configuration of the cornea. And this is the Fleischer ring, which is pulsed iron stain, shows focal deposition of iron in the corneal epithelium surrounding the cone. This is the trigium. Of course, all of us know about the trigium, but what about the histopathology of it? The epithelium varies between the epithelium of the cornea varies between atrophy, hypertrophy, metaplasia, and dysplasia. The stroma contain hypocellular areas of degenerate hyalinized collagen. Intermingled with this area are large clumps of red-stained strands which stain positively for elastin, which is called elastotic degeneration. One of the important subjects to talk about in the cornea is corneal iron deposits. The corneal iron deposits may be epithelial, like in rust rings, consist of residual rust following the removal of metallic foreign body, or Hudson-Stahley line, which occur as a junction of the upper two thirds and the lower third of another normal cornea. Ferry's line occurs in front of the filtering blip. Stoker line occur in front of a pterygium, and Fleischer ring occur at the base of the cone of keratoconus. This is an illustration of it. As you can see, Ferris line at the edge of the filtering blip, Stoker lines at the edge of the tracheum, Stahley-Hudson line at the between the inferior third and the upper two-thirds of the cornea, stellate line at the center seen after myopic refractive surgery, and Fleischer ring at the base of the cone of the cornea. Another iron line may be found adjacent to corneal elevation in Salzmann degeneration, corneal graft, and other refractive surgery such as radial keratotomy, PRK, and laser-assisted in situ keratomyelitis. Stromal siderosis is as a result of intraocular iron foreign body, corneal blood staining due hyphema, especially in 8-ball hyphema, clears slowly from the periphery. As you can see here, it's blood staining of the cornea, and these are iron deposits within the stroma of the cornea. To speak about epibulbar masses. Epibulbar masses, it covers part of the globe, like in allergic reaction, flectinules, or vernal limbal lesions, amyloid perilimbal or associated with skin disease, benign nodular fasciitis, and one which is commonly met in ophthalmology, which is the dermoid. Epibulbar dermoid, unusual congenital anomaly that contain mesoplastic tissues covered by epithelium, temporal or superior temporal area. Choriostoma, benign tissue element in abnormal location. This is the dermoid. Choriostomas is a benign tissue element in abnormal location. Here is in case of a golden heart syndrome, which contain epibulbar dermoid, accessory ocular appendages, oral fistula, and vertebral abnormalities, hypoplasia of the soft and bony tissues of the face. Here there is a case of intraepithelial Bowen's disease. As you can see, the most important thing in Bowen's disease is what is intact basement membrane. There is a full thickness involvement of neoplasmic cells with mitotic figures, multiple nuclei, and intact basement membrane. This is what is called intracellular epithelioma or Bowen's disease. These other examples for epibulbar masses. It's very rare, but we can find it. It's like these lymphomas, and this is malignant. This is malignant melanoma of the conjunctiva. It's also one of the epibulbar mass. It's contain pigmentation, intracytoplasmic melanin, and mitotic figures. Other causes of epibulbar mass like mononucleosis, nevi, flat papilloma, as you can see. Also, pterygium may be one of it. Sarcomas, salmon patches associated with relapsing polychondritis, and squamous cell carcinoma, and subconjunctival nodule associated with Crohn's disease. Synthetic fiber granuloma, also one of the causes of epibulbar mass. Thank you.